Hello everyone, now let us discuss about CPT coding guidelines for counseling, risk factor reduction and behavioral change intervention, which comes under the preventive medicine. So new or established patients. These codes are used to report services provided face-to-face by physician or other qualified healthcare professional for the purpose of promoting health and preventing illness or injury. They are distinct from E&M services that may be reported separately with modifier 25 when performed. Counseling and behavioral intervention services can be reported with 25 modifier along with E&M. Risk factor reduction services are used for persons without a specific illness for which counseling might otherwise be useful as a part of treatment. And preventive medicine counseling and risk factor reduction interventions will vary with age and should address such issues as family problems, diet and exercise, substance use, sexual practices, injury prevention, dental health, diagnostic and laboratory test results available at the time of encounter. It can vary from age and should address these various issues. Behavioral change interventions are for persons who have a behavior that is often considered as an illness itself, such as tobacco use and addiction, substance abuse or misuse, or obesity. And behavioral change services may be reported when performed as a part of treatment of condition related to or potentially exacerbated by the behavior, or when performed to change the harmful behavior that has not yet resulted in an illness. Any E&M service reported on the same day must be distinct and reportable with modifier 25. And the time spent providing these services may not be used as a basis for E&M code selection. Whenever E&M service is performed, it must be considered as distinct and reported with modifier 25. And usually the behavioral change interventions, they are governed by time. And that time should not be taken as basis for E&M course. Behavioral change services involve specific interventions of assessing readiness for change and barriers to change, advising a change in behavior, assisting by providing specific suggested actions, and motivational counseling and arranging for services and follow-ups. For counseling groups of patients, use 99078. And the health behavior assessment and intervention services, which are 96156, 96158, 96159, 96165, 167, 168, 170 and 171 should not be reported on the same day as the codes 994012 to 99412. Here we will be discussing about 994012 to 99412. Now, preventive medicine, individual counseling. Preventive medicine counseling and risk factor reduction interventions provided to an individual come under this category. They are categorized based on time. So 99401 must be given when approximately 15 minutes are spent. 99402 should be given when 30 minutes are spent. 403 for 45 minutes and 404 for 60 minutes. Preventive medicine, individual counseling. Now coming to behavioral change interventions, individual. For smoking and tobacco cessation, two codes are there, 99406 and 99407. Whenever the time spent is 3 to 10 minutes, that is from 3 up to 10 minutes, you need to report 99406. When it is greater than 10 minutes, you need to report 99407. And for alcohol and or substance abuse, structured screening, for example, AUDIT, DAST, and brief intervention services. Whenever the time is 15 to 30 minutes, you need to report 99408. When it is greater than 30 minutes, you need to report 99409. Now coming to preventive medicine group counseling. Preventive medicine counseling, it involves preventive medicine counseling and or risk factor reduction interventions provided to individuals in a group setting. Previously it was individual codes. Now we are talking about group codes. There are two codes. When 30 minutes are spent, you need to report 99411. When 60 minutes are spent approximately, you need to report 99412. Preventive medicine group counseling codes. Now let us see an example. A 45-year-old patient presents for annual healthcare maintenance. Social history. SH means social history includes chronic everyday smoker. Labs are ordered and the patient was counseled regarding the risks and consequences of smoking. That is, patient has undergone smoking cessation counseling. And the time spent for smoking cessation counseling is 7 minutes. So first, his reason for visit is annual healthcare maintenance. Additionally, behavioral change services are also performed. So first you need to code 99396. Established patient, age is 45 years. Along with 25 modifier and 99406 for smoking and tobacco use counseling. Use cessation counseling visit intermediate. That is greater than 7 minutes and up to 10 minutes. If it is greater than 7 minutes, if it is greater than 10 minutes, then you need to code 99407. But here it is 7 minutes, so you need to report 99406. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.